Hey everyone, thanks again for joining us here today. I'm your host, Jared Taylor. We have a very special episode here to discuss Availity's acquisition of Diameter Health. And joining me here today is the CEO of Availity, Russ Thomas, and the president and CEO of Diameter Health, Mary Lantin. Thank you both for being here.
Hey, Jared.
Great to be here.
Let's dive right into it. Would love, Russ, you've been on in the past one other time. So maybe everyone give us their 30, 60-second intro on your backgrounds, and then we'll talk more about this acquisition.
Yeah, Mary, you wanna go first?
Yeah. Thank you for having me. President and COO at Diameter Health. I have a public health background, have worked in multiple health IT startups, and really have a passion for data and analytics, really using data and analytics as the platform for change, to really make an impact in improving quality and making our system more efficient. And we'll talk about why Diameter is joining forces with Availity. But Diameter has been a great place to drive that mission forward, and incredibly excited to be partnering with Russ and the broader Availity team.
Yeah, and Jared, great to see you again. Russ Thomas, CEO at Availity. My background is in health information. Been at Availity now for over a decade, which seems like a long time because it is, but I've enjoyed every minute of it. And really excited, just like Mary, to partner with Diameter, do some really cool things in driving efficiency and effectiveness and improvements in quality and in healthcare through this new relationship.
Yeah, I was excited to hear the news. Then I got pinged by a couple people saying, "Did you see the news?" I'm like, "I follow all this stuff. Yes, I saw the news. This is amazing." And also, when we have people on the show, I continuously follow them, right? So I'm going to see anything that Russ is attached to with Availity. So it's always funny when people do that. What I'm curious, I want to kick things off, and maybe we can start with you, Russ, and then Mary would love to hear your thoughts. Obviously, is being the company that was acquired, how do you think this acquisition will disrupt healthcare?
Yeah, Jared, thanks. It's a great question. There's no debate that segments of healthcare, certainly need disruption, and I think nothing more so than the administration of healthcare. Some recent data out of McKinsey, tells us that 25% of all healthcare costs are administrative cost. Just the processing of basic transactional workflows, claims and those components of it are, 6%. Think of it like a 6% tax on every dollar of spend in healthcare and growing, and that's just unsustainable. And when you look at why, I think a lot of that is because of the antiquated ways that we go about sharing information, sharing data, engaging providers with health plans and their patients around their medical status, right? Their clinical status. And we have built, as you know, a very, very robust, large network transacting, communicating, engaging between 2 million providers and, literally, every health plan. I think we've done a really nice job in the sort of core administrative side of that equation, but we've just started to tackle the clinical workflow, which is, as Mary will describe, it's much more challenging, right? Because you're dealing with unstructured data, a lot less standard concepts and data elements and such. And so, just fundamentally, I think the combination of Availity and Diameter creates a platform through which to standardize and bring life to clinical data that today is largely distributed and shared in, like I said, fairly antiquated ways, if at all. And I'm sure Mary will get into some of the specifics around, how she thinks about it, and I'll be glad to do the same. But conceptually, that for us, it's really that simple. It's, we've got a great administrative financial platform, and now we're going to add at scale the real-time actionable clinical data to that data flow.
And Mary would love your thoughts on this as well.
Yeah, as I joined Diameter, Diameter is a place where we have sought to, and I believe we've accomplished, to make data really accessible and organized and actionable. And as Russ had said, our focus has been on the clinical side. And over the last decade, there's more data than we know what to do with. And really, how do you make that data useful? And the clinical data are dirty. And it really has required a lot of expertise and years of investment from a research standpoint to be able to normalize that data, enrich the data, and organize it in a way that it can be used. And so we have really focused on that upcycling of the data to make it valuable to help. And we'll talk about, the different ways that it can be used. But I truly think we're going to be disruptive because Availity is just the premier network from a from a data standpoint, sitting right in the middle uniquely as in between the providers and the payers. And if I had to think of a home for Diameter to make an impact, we are at the cross section of all the data and also are uniquely positioned together as we partner to deliver intelligent data that's informed not just by the administrative data, but the clinical data to where it can really be used and make an impact. So I think it's really the combination of the clinical and claims, but also having that engagement platform to get it to where it needs to be to really make an impact.
Thank you both for your thoughts. Super super exciting to hear. I have a question, and I know part of your response into how this will disrupt healthcare. Uh, you already probably answered parts of this, but I'm still going to just ask this because I'm curious. Can both of you? We'll start with you, Mary, this time. Can you tell me more about the value of actionable, real time, and precise data, and how that brings value to the whole industry? I know parts of both your answers had some of that in there, but let's kind of narrow
Yeah.
in our focus here.
Yeah. I think access to real time data matters in terms of being able to make an impact and inform decisions before they're made. And I really see the impact of it having an impact across a number of axes, both impacting payers and providers, but there are implications that help for a clinical standpoint in terms of driving care improvement initiatives and just care pathways. From an operational standpoint, as Russ had mentioned, the ability to reduce the inefficiencies. And from a financial standpoint, just all of that downstream will improve from a financial standpoint performance. So, at a high level, there are different specific use cases underneath each of those buckets. But it all starts really with having the best data that you can understand and pull together at the patient and population level.
I'm gonna kick it over to you, Russ.
Yeah, my perspective, I agree with everything Mary said, and then I just I take a when it comes to to opportunities to drive improvement in the administration of healthcare. One of the things I've learned in my tenure at Availity is you got to get there and show ROI fairly quickly. That's how you drive sustainability. That's how you take things from pilot point solutions to true scale. And I believe that the absence of actionable clinical data in the healthcare workflow, healthcare ecosystem, creates tremendous confusion, opportunity for subjectivity, and a lot of randomness, right? And but content is king, right? Information is king, and what we're really talking about doing here is bringing that information to life in use cases like automating authorization workflow, automating medical necessity workflow, the things that today result in phone calls and faxes and complete disruption of the encounter, right? If you sort of start with the premise that a physician, right, or a provider wants to provide quality health care, and in the context of that process, right, that workflow, they have to jump through a variety of hoops with that patient's health plan to make sure that the procedure they want to engage in or the med they want to prescribe or the referral they want to make is authorized or approved or allowed. Today, way too much of that workflow is still human driven, right? And it has to be automated. No other sector of the economy would we tolerate the level of delay and inaction and frustration that we have in healthcare. So the opportunity to bring that clinical data to life in the workflows that we are engaged in today will yield, I think, tremendous savings to both health plans and to providers, and will significantly reduce the frustration and abrasion and uncertainty that, as you and I both know, Jared, makes physicians crazy, right? I generally, like I said, start with the premise that physicians want to provide quality health care. They want to do it within the structure and the requirements of the patient's health plan. So now we are going to bring that process to life, bring it to real time, and hopefully eliminate a lot of the downstream complexity that results from today's analog workflow processes.
Yeah, thank you both so much. I want to kick over. I'm looking for an example from both of you, or maybe just from one of you, whatever you want to do with it. So, in your answers, you were really alluding to the importance of clean data, right? That was part of the question. Can you give us an example though of how I guess providers and payers benefit from this clean data?
Yeah.
Yeah,
Yeah, Mary, jump it, because I think you talking about some of the upcycling work and how you pull
yeah,
that into use cases is a great
yeah.
example.
So if we take HEDIS reporting as an example, nope, it's done today, and we've worked with a number of payers that have had data go through our API, have used our leverage our API technology, and as a result of that process, it's really accomplished two things. They've, from an accessibility standpoint, gotten data more quickly, and from a second standpoint, have been able to identify clinical information that absolutely informs the complete patient picture. And so, from a compliance standpoint, to Russ's point earlier, from an ROI perspective, we've worked with payers where we've seen an increase in HEDIS measure compliance by up to 20%, just because data that previously had not gone through Diameter's Fusion Engine, they weren't able to identify specific information about a patient. And after having gone through the upcycling information, it fills in those gaps. And that you could play that out. That's a microcosm for how many other cases is it going to be helpful where you understand the full picture of what's happening from a patient's for a patient from a clinical standpoint.
Thank you so much, and I can already see the rapport you two have built. The biggest test is how do people on a podcast together take and pass off
Yeah,
questions. It's a huge test. Like that
yeah.
was that was how I was judging this acquisition was how do they answer questions? Do they let the other one answer? I'm just kidding. Uh, let's kick over and we'll kick this one back to you, Russ, to start, and then
Yeah.
again, Mary, we'd love your thoughts. How will this acquisition support provider administrator burnout? This is something we hear all the
Yeah.
time. Um, I would love to hear your thoughts, Russ.
Great question, Jared. So we spend a lot of time with our provider clients. I've personally been on a road trips recently, to go see some of our largest health system clients, and I spend a lot of time with we have a physician advisory board, or a provider advisory board that is just awesome. Gives us great feedback on what their frustration pain points are, and as you know, right, from where you sit and all the people you talk to and engage with, um, there's just a lot of frustration in the administrative back end process, right? Without naming names, I was speaking to one of our larger health system customers, went out to visit them in Texas, and we're talking about the authorization process. I just use that one. That's one everybody loves to beat up on. I think rightly so. It's such a frustrating process for both providers and payers. And we were sitting in a coffee shop across the street from the main hospital. And she goes, "Well, I've got a building down the street there. And in that building, I have 100 people who do nothing all day but manage authorizations." I'm like, "That's not possible." She goes, "Well, that it is possible, and that's what they do." And she goes, "The problem is I can't keep the seats filled. So I'm having to build overtime, I'm having to create overtime shifts. I'm burning people out. I'm losing people." She goes, "Why can't we automate this authorization workflow in ways that allow me to take my 100, down to 50, or, even lower at some point, and move those people to jobs that really bring value to the healthcare system?" Because today, no one would argue that people sitting in offices, on both the payer and provider side, answering phone calls from each other to determine whether an auth is approved, right, is bringing any value to the system. It's waste. It needs to be eliminated, and it causes a ton of burnout. And I do think that one of the outputs of the COVID pandemic is it's made it harder to fill those roles. And I think it's meant for providers that they've had to leave a lot of revenue you know behind, right, because they literally don't have the people to chase down the approvals, to manage the denials that come from some of that workflow. So you can just feel how burned out they are with these, again, sort of analog, antiquated processes, and that's what we're targeting in this in our work together.
Yeah, and the only other point I'd add is what's unique is the coming together of the clinical data, which they physically had to go get at times,
Yeah.
because in the silos that Russ had referenced, sometimes they're picking up, actually going and getting a piece of paper and looking for that. So that's eliminated from a burnout standpoint, but also, in the authorization example, the benefit of having the clinical data as well as the claims data together to really just where there's a decision to be made, the time will be spent where it needs to be made versus trying to go get the data and understand the picture.
Absolutely. Thank you both. That was
So,
great.
so the analogy, Jared, that we've used for this combination is that Availity, when it comes to clinical, in particular, I think we've done a nice job of going out and creating a lot of endpoints. What I would call, in my analogy, we've been drilling for oil, and we've found a lot of oil, and typically we've just exchanged that directly with the health plans we work with. So unrefined, um, and unfortunately, a lot of cases, sort of less than ideal, if usable at all, data. What we have now with Diameter is a data refinery, the ability to bring that raw crude, into our four walls, to refine it, to upcycle it, and to then deliver it back to our clients in ways that fuels their use cases. Whether they're, and again, they're not all created equal, right? If you've seen one implementation with a health plan, particularly when you get into the clinical workflow, you've seen one implementation, and to be able to refine that data, and I don't like the word custom, but to be able to deliver it to our clients in a format that they can consume it and use it and plug it right into their business needs is, I think, truly unique, a unique combination in healthcare.
And for both of you, my last question I have here today is another one for our listeners. Give us an overview of what we can all, expect from Availity Diameter Health. Let's talk about it, like at combined over the next 5 years, or even go shorter than that. Give us the next 12-month outlook, and then give us future.
I'll take a stab at the first.
Yeah, fire away, Mary.
Yeah, I think it's building on. I think we will have accomplished what we set out to do in increments to that 5-year timeline, in terms of what we described as our disruption. Um, those are audacious goals, but I do think we're positioned to tackle them. If we improve prior authorization, we have made our mark. But I don't think it's limited to that. So I think that disruption that we talked about will be incremental, and we'll measure that across the different points where we can show that ROI. And I think that will be accretive over time, to really being disruptive. So I think the themes are the same, but I think it's the coming together and really making together a platform that is a platform for broad engagement, that really is connecting the different stakeholders in a different and meaningful way across the healthcare ecosystem.
Yeah, and for us, Jared, it was very intentional. I think I know we bought a great company with a great leadership team. So a big part of our mission is to build upon what Diameter has already done, and not to really try to change things up too much, because they've done such a great job. You know, Diameter will be our center of excellence at Availity for clinical data management, clinical data exchange, driving use cases that really require clinical data. And out of that, should come as Mary described, right? Whether it's solving the authorization problem or the, more accurate, actionable data in HEDIS, or gaps in care, right? Helping providers close gaps in care with actionable data. I think the world is pretty wide open for us at this point.
Really appreciate having both of you come on to share your story. I'm jealous of wherever Russ is. I missed that in the
I know,
beginning.
right?
Yeah, I don't know about that.
Like,
Oh yeah, no, it's Montana. In fact, we were on a call earlier today, and somebody joked about reaching out to providers, right? And it's one thing to connect to all the providers in Boston, and whoever was doing the product review, not knowing where I was like, but take a state like Montana where you can't get out and visit with, and individually integrate every single provider. And I'm looking around going, well, you sure? You probably can't do that here for sure. So yeah, it's beautiful. I
I mean,
snuck away for a few days, Jared, and got out of the Florida heat.
I thought I knew skies, but there's not even an inkling of a cloud.
Yeah,
Like, it doesn't even look like our sky. Yeah, it's wild. Yeah, you got out of the heat for a bit, huh? Um, yeah,
just me and the dogs.
nice. Love to hear it. Well, hopefully you get some relaxation in there too. But I know you'll be you'll be working the whole time too, probably. Knowing you. Thank you both for coming on the podcast. This was awesome, and can't wait to have you come back on to talk about new
Yeah,
announcements and what's happening.
love to do it.
Great to meet you.
Thanks, Jared. Thanks,
Thanks for
Mary.
having us. Take care.